Now, some staff of the Accra Psychiatric Hospital have tested positive for COVID-19 after coming into contact with a first case recorded at the facility 2 weeks ago. The staff were isolated after a patient they attended to was later discovered to have had the virus. The situation is creating panic among other staff members. Chief Executive of the Mental Health Authority, Dr. Osei, joins us via phone for more on the current situation. Thank you very much, Doc, for joining us here on Newsdesk. Now, how many of your staff were isolated and how many have tested positive for the virus?
Yeah, thank you very much, and good morning to you and your cherished viewers and listeners. Yes, as you just said it, one person was brought in as a patient, and while there, we found her to be positive as she was tested. Now, contact tracing, we realized 107 people, including doctors, nurses, other patients, and staff, 107. So they were all tested, and one proved positive out of the 107. So one proved positive. Now, of course, they were made to go into self-isolation until their results came. And so when the results came and most of them were positive, they have come back to it. But in the meantime, when they were out, arrangements were made to cover them where they were working. And now the one who tested positive was taken to an isolation center. And he's been there for a little over 1 week. And I'm sure in the next 1 week or so, will be out. So that's the situation.
Okay, so we have just one more person, one person who has tested positive for the virus. Tell us about how you're managing the situation now at the Accra Psychiatric Hospital going forward.
Well, you already had measures put in place to be able to detect or to prevent any outbreak of COVID today. Now, these measures include, as it is with any other facility, you enter, you have your hand washing facility, that's a Veronica bucket, washing with running water, and then your hand sanitizer, and you have your thermometer gun to take your temperature, so all that is there. If you, of course, now we have a no mask, no entry policy. So if you come without a mask, you will then have a mask available for you to purchase. But otherwise, you don't enter, so mask, no entry policy. Now, if you realize that your temperature is high, and you have reason to suspect that, yes, you are a candidate for COVID, then you are taken to a holding center, and more questions are asked of you about your history, your condition. And if all that points to a possibility of COVID, then we call a team, the national COVID team, actually the municipal directors, they have a COVID team, and they will come and take a sample. Within the time, if you are a staff or a patient, then you'll be taken to an isolation center. And if the results come and you're positive, then you're forwarded to the treatment center. So that is what is happening. In the wards, all the patients have been made aware of COVID. Sometimes people think that if you're a patient on the ward or at the hospital, then you've lost 100% of your senses. That is not true. They have television, so they watch news, they know what's going on every day. Every morning, nurses have group therapy with them, where they tell them of what is happening, they educate them on the COVID, the hand washing mechanisms, they all do. What we are even thinking of putting in place here is to have every patient to have a mask. That has not been put in place, but we are working on the modality. So we have all the measures put in place.
That is very interesting. You're saying that those are the various psychiatric hospitals are getting some education on COVID-19.
Exactly.
The last time you spoke to us, you confirmed that there was some hesitation on the part of health workers to admit this patient, the initial one who tested positive. Are you pushing for a separate treatment facility for going forward for people who test positive for COVID-19 who are mental health patients?
Before that case in question, we knew that was the way forward, because if a patient is aggressive and self-test, how do they handle it? Even right now before the COVID, if somebody is aggressive and has to be seen at the general hospital, then the staff there are hesitating. Meanwhile, they have all gone through mental health training as part of their training. But when it comes to that, then they are. So we thought that we need a treatment center within the psychiatric facility. And discussions were not going very smoothly until this one came, and so everybody has seen the need. So as we speak right now, a ward has been dedicated at Pantan, which we are trying to get it ready as a treatment center. For now, it's an isolation center, but isolation only means isolate the person there. But we are trying to put that into a treatment center. The ministry has agreed, and the Ministry of Health has agreed, and working at it. So for Accra Psychiatric Hospital, you will not require any staffing because Accra and Pantan are closed. So we can easily send somebody there. But Ankapo is also designating a ward as a treatment center. So we are working on that. So these are underway.
Generally, do you have issues with congestion?
Do you have issues with?
Congestion, sir.
No. Well, fortunately, way before the COVID, we had decongested the ward. You may remember sometime back, about 5-6 years ago, Accra Psychiatric Hospital had about 1,500 patients when the ward was only meant to take 600. We took steps to decongest by systematically sending patients to their homes. So even before the COVID, there were just about 350 patients. And after the COVID, those who were well enough to go home, we sent them. So right now, just about 300 patients. So we don't really have an issue of congestion. Same story is true of the other hospitals. So congestion is not an issue for us now.
Dr. Osei, I want to thank you so much for speaking to us here on News Desk. And you had the Chief Executive for the Mental Health Authority, Dr. Osei, confirming to us that one staff of the Accra Psychiatric Hospital has tested positive after a number of them were isolated, about 107 of them isolated and tested for COVID-19 because they came into contact with a patient who proved positive. That was about 2 weeks ago.